Okay, we are live now. So far, no one has joined yet. Yeah, we are coming. We got one attendees already. Okay. So far we still have to wait for around 5 minutes. Wait for the others to join, then we can start our webinar lah. So we'll start the webinar sharp at 2 p.m. Sam.
Mr. Am I audible?
Yeah, I can hear your voice. Just
Okay.
wait for a while first. We are on around 2 p.m. we will start.
All right. Okay.
I think around 1 more minutes. Okay. We are live in Facebook as well. So I think about 30 seconds more, then we will start our webinar lah. Okay, I think it's 2 p.m. now, so we will start our webinar now. All right. Hi, good afternoon, everyone. My name is Yen from the Division of Program Promotion. Welcome to our Utah Live webinar, and I'm glad to see you all here. Today, the topic will be on faculty preview of the Faculty of Medicine and Health Sciences. We are proud to, we are happy that we are managed to invite 4 different speakers from 4 different departments, which is Dr. Ao from the MBBS, Ms. Mageswari from the nursing, Ms. Oi from TCM department, and Ms. Swapnila from the physiotherapy department. All right. After the topic sharing session, there will be a Q&A session. So if you have any question, please click on the Q&A button below the screen here. And due to the limited time, we may not be able to answer all the questions, but we will try our best to answer all the questions. All right. And Zoom will be our main platform. And at the same time, we will be live on our official Facebook page as well, which is at Utah for you. If any of your friends are yet to register to Zoom, please feel free to ask them to join at our Facebook Live. All right. Before we start, here are some of the backgrounds of our speakers. So first of all, Dr. Ao, she is a tutor from the Department of Clinical Science, and she holds a Bachelor of Medicine and Bachelor of Surgery from University Tunku Abdul Rahman, and her area of expertise are preclinical science and basic clinical skills. All right, next, the speaker will be Ms. Mageswari. She is also a lecturer from the Department of Nursing. She holds a Master of Science in Nursing from University of Northumbria. And her area of expertise are general nursing and pediatric oncology nursing. Our third speaker is Ms. Oi. She's a lecturer from the Department of Chinese Medicine, and she holds a Master of Arts in Chinese Literature from the East China Normal University. While our last speakers, which is Miss Swapnila, she is a lecturer from Department of Physiotherapy, and she holds a Master of Physiotherapy in Obstetrics. Her area of expertise are physiotherapy in obstetrics and gynecology. All right, without further ado, let's welcome Dr. Ao to start our webinar session. Dr. Ao?
All right, yes, thank you, Mr. Yan. So right now I'll share my screen first.
Okay.
Okay, so very good afternoon and welcome to Utah Cyber Open Day. So my name is Carmen, and today I will give you guys a brief introduction on MBBS, one of the courses offered under the Faculty of Medicine and Health Sciences, Utah. All right, so the Faculty of Medicine and Health Sciences, or in short FMHS, was established in the year 2009 in Utah. So we aspire to be the preferred center of education and research for medical and health sciences, and also to produce graduates who would serve and improve the quality of life of the community. So the vision of our course is to be a model course for the education and training of doctors who can provide promotive, preventive, curative, and rehabilitative medical care of the highest possible standard. So our mission is to provide an environment that nurtures medical professionals who can, first of all, meet the requirement in order to register with the Malaysian Medical Council, or MMC, offer a high standard of medical care to the community in a safe, efficient, effective, and caring manner, contribute positively to the welfare and growth of the medical profession, as well as contributing to the health and well-being of all Malaysians. So the aim of the course is to prepare our graduates to become caring and competent doctors who practices evidence-based medicine. So the MBBS course is generally a full-time course lasting for 5 years, which will be conducted in 3 phases. So the first 2 years are preclinical years, in which the students will learn about the basic medical knowledge as well as basic clinical skills. So their preclinical years will be based fully in the Sungai Long campus. So the students in year 1 will be taught the core subjects and as well as the integrated systems, whereas in year 2, the students will be taught introduction to patient. So the students will be exposed to clinical training in order to facilitate the transfer of classroom-based knowledge into application. So after that, from year 3 to year 5, the students will then enter into their clinical years. So the students, the clinical students, we call them, they will go through rotational clinical postings and are fully hospital-based. So they'll be posted in specialized clinical areas, so mainly in Hospital Ampang, HKL, and also Klinik Kesihatan. So the classes and discussion sessions will be held in a clinical training center nearby the hospital. All right, so upon successful completion of their MBBS degree, so after 5 years, the students will have to provisionally register with the Malaysian Medical Council. So they'll be given a temporary MMC number. So it is compulsory for all the MBBS grads to undergo a 2-year internship, or I think in Malaysia, we better know it as a housemanship. So they have to work as house officers in accredited government hospitals. So after completing their postings in the main specialties, as well as the assessments, the house officers will then be eligible for a full registration. So after that, they can get their full registration MMC number. Then they are required to serve as medical officers at any government or public university hospitals, medical centers, and clinics. So only after completing their compulsory service with the nation, the medical officers, they can either choose to continue to become an MO, a medical officer in the government service, or they can venture into private practice as a private practitioner or have their own clinics as a general practitioner, GPs. So on top of that, they can also choose to pursue a postgraduate degree and training if they are keen, they are interested to become clinical specialists, researchers, or even venture into administration and management. All right, so the local courses include Master of Medicine, Master of Surgery, Master of OB-GYN, Pathology, Public Health, and etc. So whereas examples of overseas courses include MRCP, FRCS, and more. So after they have taken these masters or any other overseas courses, they can further subspecialize into a particular discipline with additional years of subspecialty training and gazettement, etc. So after that, they can practice as clinical specialists, either in public or they can choose to go into private hospitals as a group practice and even in universities. So whereas for those who are more keen to go into the research field or into the academia, they can go into either public or private universities, research institutes, and even pharmaceutical organizations. Whereas for those who are more inclined towards administration or management, they can choose to go into hospital management as a CEO, directors, or even venture into private companies as medical consultants or medical directors, to name a few. For example, like insurance companies and etc. Okay, so most of the courses can be undertaken in Malaysia, except for some of the uncommon subspecialty fields and certain foreign advanced degrees such as MRCP, MRC Path can also be taken either in part or fully in Malaysia. So over here we have is our fee structure. For Malaysian students, the total fee for our course for the full 5 years is RM 260,000 and 150 ringgit. So whereas for international students, the fees for 5 years would be 317,000 and 500 ringgit. So all right, so this is a very brief my introduction for the MBBS course offered by the Faculty of Medicine and Health Sciences of Utah. All right, thank you very much.
Okay, thank you, Dr. Au, for the sharing session. Next, let's welcome Miss Magus for her sharing session. Miss Magus.
Give me a minute, I will be coming on because I'm trying to share the screen.
Yeah, sure.
Do you get the sharing? Is it on?
Yeah, we can see it. You please click on the full screen. Then
Yeah. It's not coming on mine. A full screen doesn't come on to mine.
is there an issue?
Okay, I can't get that on mine. I don't know why.
You want me to help you to share?
Yes, please.
Yeah, just a moment.
Thank you.
Just a moment. Wait. Can you see?
Yes, I can see now.
Yeah, okay.
But
So
how is the control? Can I control?
No, you just let me know, then I will next slide for you lah. I move to the next slide for you.
Okay. Hi, good afternoon. I'm Mageshwari, a nursing lecturer. Thank you for being here to listen to our talk, foregoing your very important afternoon nap. Today, I'm here to enlighten you on the Bachelor of Nursing Honours Program. Next slide. Next. Okay. All right, this is our Kampa and Sungai campuses. Next slide. What is nursing? Yeah, nursing is a very unique profession as it has both the components of arts and science. And what is arts of nursing? The arts of nursing is more than just knowing, it is doing. It bridges information for nurses to patient in a skillful way. It is the application of all science known to the nursing to give you an utmost care the patient needs. And then, what is science? Okay, it includes the utilization of critical thinking to make sound judgment and select the best care solution for their patient. Nursing is steeped in the evidence-based practice, scientific concepts, and technical know-how. While it is important to note that all these elements can come together only under a careful application of a knowledgeable nurse. It is the human element that brings science into practice. Therefore, nursing is both an arts and science, and in this field, one cannot exist without the other. Next slide, please. Okay, before we look at the program, I will enlighten you on the scope of a registered nurse with a degree. As a registered nurse with a bachelor's degree, you have the option to select from management, clinical, or education to enhance your career. These are three of the options, and management, nursing managers, chief nursing officers, and others. Under the clinical, you have diabetic nurse, wound care specialist, and many others. And of course, education, you are a tutor, lecturer, clinical instructors, and others. Next slide, please. In this era, the scope of nursing is diversified into areas of clinical and non-clinical nursing. In the clinical arm, the nurses can work in hospitals, clinics, public health, community health centers, military medical services, and others. On the other hand, in the non-clinical areas, the nurses have a vast scope to work in school health, occupational health, nurse-led nursing homes, legal nurses, consultant, pharmaceutical industries, insurance industries, and universities and others. Next, please. Now we will look at the nursing program in Utah. It is a Bachelor's of Nursing Honors, which is a full 4 years course. There are 2 intakes per year in May and October. Each year consists of 2 long trimesters, 1 short trimester. The long trimester is 14 weeks and the short trimester is 7 weeks. The long trimesters are in January and May, whereas the short trimester is in October. Next slide. Now we look at the entry requirement. Okay, for nursing, we have to have the SPM certificate with equivalent with 5 credits. Okay, the mandatory 5 credits are Bahasa Malaysia, mathematics. Mathematics can be from elementary, modern maths, or additional maths. Then you need a credit in either one of the science subjects, and general science, biology, or chemistry, and a pass in biology, physics, and a pass in biology. Another 2 credits in any other subjects, one of it is English language. With the SPM requirement, you need to have STPM with minimum CGPA of 2.5 and above. The other equivalent to STPM, you can have a foundation in science, arts, Utah, minimum CGPA of 2.5, and A-level with a grade C in 3 subjects, matriculation foundation, minimum CGPA of 2.5. Then you have the unified examination certificate, grade B in 5 relevant subjects, and other equivalent qualification with CGPA of 2.5 recognized by the Malaysian government. Diploma in nursing from recognized institution by Malaysia Nursing Board with minimum of 2 years working experience also can come into the program. Any other diploma will be also acceptable with credit transfer. Next slide. Okay, there's another entry requirement for our program, is that the applicant must be below 50 years old and free from any medical conditions. Example, hepatitis B and C, epilepsy, mental problem, HIV, AIDS, and physically or impaired senses. And the female applicant is not allowed to be pregnant during the studies, and finally, they must have passed their medical examination before entry. The next. Okay. What will you study in the nursing curriculum? Nursing curriculum is 135 credit. Students will be taking the following courses. In the basic medical sciences, students will have 16 credits. The course is, this is under anatomy and physiology, general pathology, basic genetic, biochemistry, pharmacy, and others. Next is the behavioral science, which is 10 credits, where students have communication and counseling, psychology and sociology, legal, ethical, and professional issues. Then is the core of this program being nursing sciences with 52 credits. The course under this are fundamental of nursing, medical and surgical nursing, and some areas of specialties. Example, obstetrics and pediatric, community health, mental nursing, emergency, critical care, perioperative care with management and leadership. To enhance the nursing science, there is clinical placement of 26 credit, which is 52 weeks in various disciplines. Students will be posted in Hospital Kuala Lumpur, Sunway Medical Center, community health centers. Under the component of research and statistics, which is 12 credits, there are research methodology, biostatistics, epidemiology, research project, which student will embark in their final year. Under the elective course, which is 4 credits, students are allowed to select an area to enhance their knowledge and practice. Finally, there is the MPU subject, which is compulsory and carries 15 credits. So therefore, it is 135 credit altogether. Next slide. Okay, now we look at the mode of delivery. The courses are delivered through lectures, tutorials. Under the tutorial, the lecturers deliver it through e-learning, case study, role play, discussion, and others. They enhance their theory with hands-on practical skill in safe environment in the simulation wards under the supervision of a lecturer before going to the clinical areas. In the final year, students embark on their research. Next slide. All right. Now let's look at the assessment methods. There are multiple types of assessment are conducted over the 4 years, but basically the final assessment will be 60% and the continuous assessment, which is 40%. In the continuous assessment, many variations of assessment will be conducted. Examples like test, quiz, assignment, report writing, case scenarios, projects, and others. Students must pass all the university exams and they have to undertake a professional examination before sitting for the Nursing Board Malaysia registration examination. Without passing this exam, they cannot be a registered nurse. So it's important that they pass this professional examination set by the Malaysian Nursing Board. All right, next. The highlight of today, why study nursing in Utah? All right, as it's an accredited bachelor's program approved by the Malaysian Ministry of Higher Education and the Malaysian Nursing Board. University's vision and mission is to achieve the best nurses in this country. We have a highly trained and qualified lecturers. It has a non-profitable tuition fee structure. We only take small number of students because the organization looks at quality rather than quantity. Students have good exposure to placement and practical areas. Students have adequate physical environment and facilities and support. Next, please. All right, finally, we come to the non-profitable fee structure. Total cost for the 4 years is 66,050 ringgit, and for the Malaysian student and international student is 86,100 ringgit. Can we go to the next slide? All right. Another very important point is that we have some scholarship and sponsorship for nursing program, and they are Utah scholarship or sponsorship under Hospital Sultan Aslan Shah, Kampa, and another is Sunday Medical Center, Petalinjaya. At present, we have some students under these scholarships or sponsorship. Of course, we have still the PTPTN loan as well. Next. The next few slides show you the facilities of our nursing department as well as the FMHS. Okay, these are students training, practicing. Next, please. These are some of the high fidelity simulation mannequin for students to practice. Next, please. And this is our skill lab for students to learn their anatomy and physiology. Next, please. All right, these are two of our graduates who have achieved a distinction in the Malaysian Nursing Board registration examination. We are proud to announce that. Next, please. And these are some of the students' activities. We had two groups of students from Korea, inbound students from Korea, and these are some of the activities by them, plus activities by our students. Next, please. This is Hospital Sultan Aslan Shah, actually is an artist impression. Next, please. And this is our dedicated lecturers for the nursing program. Thank you.
All right, thank you, Miss Megaswari, for the sharing session. Next, we will invite Miss Oi for the sharing session. Sorry?
Yeah, yes.
Yeah, can you turn on your video?
Yeah.
All right.
Yeah, hi everyone. I'm Miss Ui Chiet Ui from TCM department. This is our Songai Long campus, and this is our Kampa campus. So our TCM hospital will expect to open the Chinese medicine hospital next July, expected.
Sorry, Miss Oi, can you make it full screen?
Yes.
Okay, thank you.
Okay. So why study Chinese medicine? Chinese medicine is a rapidly expanding profession and an obvious growth area for integrated and interdisciplinary professional training. Compared with the Western medicine, Chinese medicine treatment and Chinese herbs are more natural and less of chemical content. It provides another choice for human beings to treat disease. So the Utah Bachelor of Chinese Medicine is a diversified curriculum with a combination of 60% on Chinese medicine content and 30% on health sciences. The program aims to equip students with a strong foundation in the principles, theories, and practice of Chinese medicine, material medical, acupuncture, and Tuina massage. So another 10% is our TITAS, COCU, and other university compulsory subject. So our purpose is to let the student, to build the student to be good in skill and theories Chinese physician. So our content, our curriculum for Chinese medicine included the history of the development of traditional Chinese medicine, the concept of traditional Chinese medicine, the awareness and cognitive of traditional Chinese medicine on human life, health, and disease, like the 5 elements, yin yang, wu xing, qi, blood, etc., and the prevention and therapeutic principles of traditional Chinese medicine. So why study in Utah? Why choose Utah? Our teaching is bilingual teaching. The curriculum is taught in both Chinese and English language. Hence, students will be able to communicate in Chinese and English language. They also to learn to appreciate the classical Chinese during the course of study. So we know that Europe, America, they always train students in English. But Taiwan and China, they all train Chinese medicine students in Chinese. So only our course separate to two systems. Chinese medicine content teach in Chinese and health sciences content teach in English. So the health sciences program is teaching by the staff from MBBS, nursing, and physiotherapy. So they are not teaching by Chinese medicine teacher. Our Chinese medicine lecturer only teaching Chinese medicine content. So it's a bit different with others college. The student good in English, the Chinese physician good in English is very hot in market. So it's the first point to study in Utah. So the second one, quality teaching team and the flexible choice of clinical training. So we have more than 15 full-time lecturers in our team and some visiting professors from collaboration university like Nanjing University. Our academic partner includes Nanjing University of Chinese Medicine, Shanghai University of Chinese Medicine, Guangzhou University of Chinese Medicine, Guangxi University of Chinese Medicine, and Zhejiang Chinese University Medical University. And our students can also further their study in Yangzhou Hospital. So they have many choice. They can choose to practice in local hospital like Tongxin Hospital. They also can choose to practice in China, or half of them, or both of them. So maybe 6 months in China or 6 months in Malaysia, or 4 months, 6 months in China and 4 months in Malaysia, or whole year in Malaysia or whole year in China. So students have many choice. If our hospital, Chinese medicine hospital, can operate the end of next year, maybe students got a new choice. So the third one, equal attention on internal medicine, acupuncture, and trainer. Normally, the Chinese medicine course in the world, for example, in China, they separate to two specific area. Some they mean in internal medicine, some they choose trainer and acupuncture. So internal medicine and trainer and acupuncture, they are different area. So the Chinese physician in China, if they specialize in internal medicine, they wouldn't do trainer and acupuncture. But our market, we need all-in-one Chinese physician. So we train the student all-in-one. So student will be managed to learn to manage the skill for the whole area. Included internal medicine, acupuncture, and trainer. So we have 3 acupuncture subjects and 4 trainer subjects provided. These acupuncture and trainer subjects are trained to deeply on many practice. So not only the basic only, but they also learn the skill to do it. So they will start to do acupuncture and trainer after graduation. So the fourth point, apprenticeship. Apprenticeship is one effective way to learn Chinese medicine. Students learn knowledge in the formal classroom setting and also will be assigned a lecturer whom students to learn deeply. They will follow the teacher, the advisor to the clinic, to all the medicine factory to learn more about the area. So students have also have chance to study with other health sciences student and MBBS student. So they will have good experience and networking. if they graduate from Utah, they will study together with other departments. In our FMHS, we have 4 departments, so students will study with others. So this is our Chinese medicine subject. They will learn basic of Chinese medicine, diagnose, prescription, material, etc. They will learn many acupuncture and trainer subjects. They will learn health sciences subjects also. It's about 30% content of health sciences. So this is our teaching team. Our teaching team, all of them are full-time lecturers, so they are specialized in academic. They will have 1 or 2 days for the Chinese medicine clinical training, but the student maybe will follow. This is our traditional and complementary Chinese medicine center. This is another room. The bottle is different herbs, contains different herbs. This is for study purpose. Some equipment. So students got chance to learn to recognize the herbs. This is our stimulation ward. This is our trainer and acupuncture center. So students will have some activities to learn trainer and some like Chinese Kung Fu, but there's only for the health purpose. They have practical section. So our lecturer will provide the sample, will show them how to do lah. They will do themselves, then only apply to patient. So student will recognize the acupoint while they have many practice. This is our acupuncture room. So they learn theory and practical together. So our course are very flexible and very interesting. This is one of our student training center. So we cooperate with other hospital. So students are happy. This student are study in Tongxin Hospital. They do their practice. This is Chinese herbs section, Chinese herbs department. So every course finish, every subject finish, they will have some practical session. Some they do in Utah, some they do outside Utah, like Tongxin Hospital. Sometimes we offer free consultation to the society. This is student activities. Sometimes we will offer free consultation while doing open day or other school activities to promote Chinese medicine. So we always have a Chinese medicine festival or some competition to students. Let the student join the activities and to train to get more interesting, to get some experience. Our staff do free consultation in school. Sometimes we offer free consultation during the seminar. After seminar, we let the student try the herbs and can do some consultation. Sometimes we organize some workshop. This is a trainer workshop. This trainer from Taiwan. This is another trainer from China. So our student will learn different types of trainer, different concept. So this from New Zealand. This is different types of acupuncture. So for our admission, normally January, May, and August, we have three intakes per year. For our duration of studies, 5 years. Some who hold the APC can apply for a part-time course. The part-time course length is 7 years. So you need to have STPM, CGPA 2.5 and above. If you only have SPM, then you need to join foundation before you join to the bachelor course. So for UEC student, you need 5 credits and above. So all our students need to take got 2 credit in science subject. So we only accept science student. So for the future prospect, they have many choices. The combination of theory knowledge, practical skill, clinical experience, and recognized qualification will prepare you for a career in Chinese medicine, which may include independent practice. Most of our students, they are self-employed in clinic. Some they work in their hometown by joining the clinic, or some they do some research, further study in China. So it's all related. So our student is really welcome from the market. So they always get a job after a month of graduation. So actually, Chinese physician good in English is very hot in market, because Chinese and because China and Taiwan, they are not a bilingual system, and the Europe, UK system also they are all teaching English. Only our system got bilingual system. So it is a very special point for our student study in Utah. So rather than that, they can be a Chinese medicine educator, or also be a researcher in academic institution, or herbal, or some pharmaceutical manufacturing company. So it's many choice to do for our student. Okay, thank you so much.
Okay, thank you, Miss Oi, for the sharing session. Next, let's welcome Miss Swapnila for the sharing session.
Thank you, Ms. Yan. I will just try to share my screen first.
Yep, okay.
Okay.
Yep.
All right. All right. Is it visible? Sorry. Is it okay?
Yeah, it's in full screen now.
All right.
Okay.
Okay, so good afternoon, everyone. Welcome to the Utah Cyber Open Day. This is Swapnila Jacob, and I'm the physiotherapy lecturer from the Faculty of Medicine and Health Science, Sungai Long campus. So you can see here, this is a picture of our Sungai Long campus here. And this is our Faculty of Medicine and Health Science. So this is the vision and the mission of FMHS. To be a preferred center of education and research for medical and health science, the mission is to provide a conducive environment for the acquisition of knowledge and skills for effective clinical practice, to develop values and attitudes of dedication, ethics, and professionalism in delivery of the healthcare. So today I'm going to talk about the Bachelor of Physiotherapy Honours Program that is offered in the Uttar Sungai Long campus. The Bachelor of Physiotherapy Honours is accredited by the Malaysian Qualification Agency MQA and the Ministry of Higher Education Malaysia. The program was established to fulfill societal and the market demands on physiotherapy profession. We aim to provide the educational experience, practical training, and technical competence necessary for the practice of physiotherapy. We produce graduate physiotherapists who are professionally competent and able to demonstrate good ethical judgment and compassion in the treatment of the patients. Our graduates will be trained to develop good communication skills, critical thinking, leadership quality, the ability to make independent clinical decisions, and to engage in continual professional development as part of lifelong learning. Okay, so these are the details of the program. The duration is 4 years full-time. We have 3 intakes, January, May, and October. So October is considered to be a short semester. Total program fees is RM 65,650 for Malaysians and RM 80,750 for the international students. So we can see that it's quite affordable for quality education. The medium of instruction is English, and the program is only offered in the Sungai Long campus, and we belong to the Faculty of Medicine and Health Science. Okay, now these are a few of our salient features of why to study physiotherapy in Uttar. So first of all, we have well-equipped labs, state-of-art lecture theaters, electrotherapy and exercise therapy lab and gym. We have all kind of high-tech machines, modalities and equipments which are needed for the study of the students. Special attention is usually paid to the hands-on skill and practical skill because physiotherapy is basically a hands-on skill. So we have all kinds of machines that we teach the students during their 4 years of tenure. Also, we have highly qualified trained staff, regular scheduled curricular classes that involves theory, practical exposure, evidence-based practice and research work. And the faculty members have published and presented several papers in various journals and conferences of national and international repute because we aim our students, physiotherapy students, they become an evidence-based practitioner. So a lot of stress is posed on taking part in the research and being an evidence-based practitioner. The teaching method includes lecture, practical tutorial sessions, face-to-face, and also in the e-learning platform. Clinical postings, training with real patients is provided in a wide range of government and private hospitals. So our students are usually posted at HKL, Hospital Ampang, Clinic Kasihatans, and also other kinds of private physiotherapy clinics where they are posted from time to time, and they can have, usually we conduct exam at their posting places also, and they gain their experience while working with the real patients. We also conduct bedside OSPE exams on real patients so that students can have a real exposure to the patients and we can assess our students actually how are they treating the patients. Another thing is the research activities. So the students gain knowledge from the research methodology and they are required to submit a research project in the 3rd year of their study. It's a mandatory requirement. So that research, they can later publish it, or they want to continue that research, and or they want to pursue later their PhDs and all this research activities. It's just the starting of the activities that is done from the 3rd year. Okay. These are the career prospects. We can see that the graduates can expect to find employments in various healthcare sectors, both public and private. So after graduation, they can work as physiotherapists in hospitals, hospices, nursing homes, geriatric care centers, physio clinics, community settings, and nowadays all the fitness sports clubs and all that. Apart from that, they can also go into education institution if their students are keen to work as a lecturer or they are more keen to work to be a researcher, they can also pursue that. After their graduation, they can also apply for postgraduate education locally or internationally. They can pursue their MS later, or later they can also pursue their MPT, that means Master of Physiotherapy, and they can go higher in their education and they can become lecturer or even assistant professor grade if they want to go into the academic side. But if they want to work in the clinicals, yes, they can go, they can become, they can hospitals, nursing home and all. Apart from that, the physiotherapist after graduation, they can also work as a private practitioner. They can open their own clinic, but yes, it's a referral job. So they cannot have direct patient walk-in. There always will be referrals coming in from the specialist doctors. For example, the orthopedic doctor, an orthopedic surgeon, or is a neurosurgeon. So they will be referring the patient to the physiotherapist. And if the therapist has his own clinic, then he can always treat the patient there. Apart from this, the master's specialization, master usually is of 2 years after the graduation. And these are the few specializations: orthopedics, neurology, cardiorespiratory, women's health, and sports rehabilitation. There are some more branches that are coming up now, like hand rehabilitation, burns. So the therapist can become, the student can become specialized, his choice. According to his choice, he can select and pursue the master's. Later, he can also pursue PhD, and it will come under the professor grades. Apart from that, our students are encouraged to participate in health camp, health checkups, and also seminars, free consultation as a part of their corporate social responsibility. And in those camps and checkups thing, we always like give free consultation, teach exercises to the patients, preventive exercises to the patients, so that, and also we can refer them for physiotherapy. And also this will be giving a chance for the students to handle and to really get in touch with the real patients. So these camps and all we are conducted in Utah from time to time. We have medical week that we conduct every year, that is almost free of cost. And also it is conducted in other hospitals. Even we go to the shopping malls and other schools where we conduct these camps just for the benefit of the patients. So Utah graduates will help alleviate the current national shortage of qualified graduate physiotherapists and be the trainers for the future generation of physiotherapists. Graduates will be eligible for registration with the Malaysian Physiotherapy Association, that is the MPA, that is the legal body that controls the physiotherapy regulations in Malaysia here. So after graduation, students can register with the MPA, and it will helpful for them to become a life member, so they can attend some conferences at nominal rates, they can have continued professional development, and also they can get their registration number. It will help them to practice, they can renew it from time to time. So they must be a member of the Malaysian Physiotherapy Association. These are few pictures of our department. These are the gym and the treadmill and the exercise therapy section. These are the electrotherapy machines. These are few group exercises that are given by the students during the physiotherapy camps in Utah. The students teaching exercises to the subjects. These all are the pictures of the camps, the free camps and checkups organized by Utah Physiotherapy Department. These are few pictures of the equipments that are there in our physiotherapy lab. Okay. That's all from my side. Thank you.
Okay, Doctor. Thank you, Miss Swanila, for the sharing session.
Thank you.
Yep. So now we will head towards to the Q&A session. All right. Before that, participant kindly help us to fill up the evaluation form, where we will put it in the chat box. And if you have any Q&A questions, you can click on the Q&A button below there, and you can just send in the question to us, so we will answer for you. All right. So maybe we just wait for a while they fill in the evaluation form. All right, while waiting, Miss Fatmila, are you there? Hello?
Yes, I'm here. Yeah.
Yeah, sorry, can we ask some questions?
Yeah, sure.
Yeah, like, can you tell me more about the clinical posting in physiotherapy?
All right. So the clinical postings in physiotherapy it actually is the heart of our physiotherapy course because it's all about the hands-on skill and all about with the treating the real patients. So our clinical postings usually starts at year 2. So we have something called as clinical practice 1, and then later next year we have the clinical practice 2, and the final year is the clinical practice 3. So the final year, that means the 4th year, is the entire clinical posting. The students are placed in different hospitals that are specialized. They have orthopedics, musculoskeletal, or they have neurology or women's health. And whole year they are actually totally out for postings. And the hospitals where they are posted are usually HKL, Hospital Ampang. We have all the major government hospitals and clinic kasehatans. So they pursue their postings there, and the lecturers will go there along with the physiotherapists there. We assess the students and we conduct the exam for them. And also the clinical postings are like 5 days a week and almost 8 hours. And I think UTAR, as far as I know, UTAR is the maximum, we give the maximum hours of clinical postings as compared to other universities. So this is our hottest selling point actually.
Okay, thank you. Yeah, we got a question here for MBBS in phase 3. When you say clinical rounds, do you mean theory or practical? Doctor?
Hi.
Yeah.
Yes, hi. So actually in year 3, it is known as the clinical years, where the students will actually be posted to either Hospital Ampang, HKL, or other clinic kesihatan. So it will be more like a hands-on, and there will be hands-on practice, and they will also see patients in hospitals. And in combination to that, they will also have theory classes or discussions back in our clinical training centers, which are nearby the hospitals.
Okay, all right. Is there any questions? Any other questions from the people? Miss Megas?
Yes.
Yep, I have one question. May I know, is the nursing program recognized globally?
Yes, the nursing program is recognized globally. First thing, we have international students in our program. So it is, if without being recognized, it cannot be, we cannot take international students. All right. And our certificate is nursing certificate because it is registered with the Malaysian Nursing Board. So with that, we can practice in any of the Commonwealth country. Of course, there is little this thing that we have to adhere to that country's requirement. Otherwise, the certificate is recognized by the country to accept you as a nurse in that country. Okay, and my certificate as a nurse registered with Malaysian Nursing Board, I have worked in multiple countries. I've worked in UK, in Saudi, in India. As well, my certificate was recognized by Australia, but I did not get the opportunity to work there.
I see. Okay. And how about the jobs that are available? Because just now you talked about employment after graduations.
Yes. If you look at employment after graduation, yes, now they are actually one of the highest demanding jobs at present. At one time in Malaysia, it was considered that too many nurses, but now it's reversed. We have too few nurses, and those with a degree program is even less. Right? So that employment is easy. Within the first 6 months, once the student has completed, they can get a job. And a lot of them are employed even before they are registered. Our students especially, they are employed before they are registered because we have a lot of Singapore hospitals coming here to select them and recruit them before even they have set for their final year of examinations. And as soon as they finish examination, they are being taken over by them. But the only, again, that because it's the different country, you have to wait for the registration in that country. But they don't have to take any exams. They just have to be registered. The paperwork takes longer, but otherwise they can be registered and get a job. In Malaysia, we have multiple private hospitals have employed our students.
Okay, all right. Thank you, Miss
Welcome.
Magus. Yep. Do we have any other questions from the participant? Okay, maybe one last question for the physiotherapy as well. Ms. Fatmila?
Yes, I'm here. Yeah.
Yeah. One last question. Do the student needs license to practice physiotherapy?
Okay, here in Malaysia, actually, after graduation, the students can become a member of the Malaysian Physiotherapy Association, and they will be giving a registration number to the student, and with that number, he's registered into the national board, and then from there the student can always practice. But when you go to another countries like Singapore and all, definitely they need to clear the license exam. For now, there is no license exam or any qualifying exam here in Malaysia. They can open their own clinic, but they must get the registration number, maybe associated with the Malaysian Physiotherapy Association.
All right. Okay, understand. Okay, I think that's all our Q&A session. Thank you for Dr. Ao, Ms. Magus, Ms. Oi, and Ms. Swamila for the sharing session. Okay, just to recap a bit, these are some of the programs that offer in FMHS. We have nursing, physiotherapy, Chinese medicine, and MBBS. All right. Okay, last but not least, we are actually having a Cyber Open Day throughout the whole August from 9 to 5. And each day we also have a webinar session from 2 to 3. So our next one will be enriching your university life with Utah soft skill programs. Okay, if you're interested, please go to the website there and click on register. And lastly, these are few of the ways that you can contact us. You can go through the website to look for us, Facebook, WeChat, WhatsApp, and email as well. All right, thank you for joining us today and have a nice day.